Ms. Sandalow?
Good morning, Chairman Catania, members of the Health Committee. My name is Judith Sandalow. I'm the Executive Director of the Children's Law Center and a proud resident of the District of Columbia. I'm testifying today on behalf of the Children's Law Center, which is the largest nonprofit legal services in the district and the only such organization devoted to a full spectrum of legal services for children. The children we serve have some of the most significant and complex mental health needs of the district, and my colleagues routinely cite the lack of appropriate mental health services as the greatest barrier to success our children face. Focusing on the budget, obviously it's been said many times, they're difficult economic times and they require tough choices. I just have a few points to make. First, I want to commend Director Steve Barron and his staff for making tough and smart choices in developing DMH's proposed budget. They have made cuts. Some of those cuts hurt children, but I think given the economic circumstances, they've chosen wisely, and we understand that this is not a year in which we can ask for cuts to be restored. But I do want to stress that children have not been held harmless, and we hope that there will be no further cuts. We believe that any additional budget cuts would be extremely damaging to children's well-being and to the district's bottom line. I don't want you to mistake my support for the current budget for satisfaction with the state of children's mental health services. I still maintain, as I've testified several times before, that children's mental health service is broken. There are about 5,600 children who are not receiving the mental health services they need, and I believe that that's a conservative estimate. The district doesn't have the necessary variety of services nor the quantity and quality of those services to adequately ensure the mental health of its youngest residents. In addition, the system is still very difficult for families to access. I believe that the Department of Mental Health has been doing very thoughtful and hard work to improve those services. They need all the money they can to make that happen. My written testimony goes into more detail about specifics, which I don't need to repeat in my oral testimony. I hope next year to be here, Mr. Catania, asking for more money for children's mental health services, and at that time we can work together to fix the system. Thank you.
Thank you very much, Ms. Sandalow. Mr.